I am Dr. Kechi Ogbuagu, a Nigerian, a public health physician for over 35 years. I have decided to leave my comfort zone and make this claim out of sheer anxiety, even desperation and fear. Out of love for my people, for this wonderful country, Nigeria, that I love so much, for my brothers and sisters out there, and for people all over the world. Each and every one of us, nobody can afford to remain silent any longer. The ongoing global pandemic of the coronavirus has made it abundantly clear that we are one interconnected people. The whole world is actually one. Issues of geography, of nations, of state, of politics, of tribe, of races, of being white or black, all of them are totally irrelevant. We are one interconnected humanity. As we watch so many powerful countries struggle with the pandemic, I do not see what needs to be paramount happening for the world to defeat this war. A war that is indeed greater than the Third World War. We must address it as one. It must be coordinated, strong action by everybody. I am calling, desperately calling, for a strong, coordinated, global response. That is the only thing that will effectively deal with this pandemic. Let me start with my home country, Nigeria. Let me also start by discussing Africa. As I speak today, Nigeria officially is recording, I believe, 35 cases of confirmed coronavirus, as well as many other there that they're trying to trace and so on. Actions are being taken. I'm not saying they are not. Contact tracing, isolation, quarantine, closing borders are important. But community spread is happening. This calls for a national emergency. Our health systems cannot cope. We know that. 70 to 75%, even 80% of our communities are rural. They don't have running water. They don't have the luxury of several hand washing under a running tap. A large proportion of our population live in overcrowded conditions. We do not have the luxury of self-isolation. Our conditions of work make it almost sometimes impossible to social distance. Our public transportation systems that are overwhelmed and overcrowded. Our markets that are death traps, where hundreds and thousands are working together in very confined spaces. The epidemic is spreading. Let nobody tell us anything else. Our response has to be strong, coordinated at the highest level. We should have, even before now, declared a national emergency. Every state in this country must be responding in the same manner. The virus knows no state boundaries. If it is in Lagos and rising rapidly, it is everywhere in this country. We need to buy time, slow this transmission so that we buy time to put the facilities we don't have in place. Hand wash instructions we need to help our people, our communities to adapt it to what they can do. For instance, build buckets with taps and make it freely available to masses of our people in the urban areas and in the communities. We need to come and produce hand sanitizers and share freely. People cannot afford to buy. Leaders at every level need to be part of this coordinated effort. Whether they're religious, whether they're community, whether they're leaders of thought, leaders in government, leaders in the private sector, all hands on deck. I say the same for Africa. There should be a strong, coordinated continental response. Africa African Union must truly show its leadership. No country in Africa is safe if its neighbor has a raging pandemic. No amount of border closure is going to work. Africa must come together and act as one. We must reach out to our weaker countries and neighbors and deal with concern for their own epidemic as if it is ours, because it is ours. For the global world, for the global powers, I say it's a huge tragedy that the global stage was set even before this corona epidemic in such a way that usual concerted global action that we see was greatly undermined. We have a crisis, we have a global emergency. Northern powers must come together. The powers in the north who have the resources and who have been able so far to limit the spread within their countries owe their neighbors a duty to reach out, even to reach out to huge global powers like the US and say, what can we do to help? If there are a shortage of test kits and so on in the US, then perhaps if Portugal doesn't have such a big problem and Portugal can produce them, this is the time to reach out. The North must realize that they can never solve the problem in their world, in their corner of the world, if the virus takes root in Africa and they do nothing about it. As long as it continues to be endemic and prevalent in Africa, none of the northern powers can ever say they have truly protected themselves. Their borders cannot remain closed forever. To the World Health Organization, I say, bravo. For me, that is perhaps where I've seen a real attempt at global leadership. I am particularly proud of the Director General of WHO, Dr. Tedros, a wonderful man. He's demonstrated amazing leadership. But I call on him now for Nigeria, for Africa. And I say to him, the wonderful WHO recommendations so far don't cut it enough for this continent. When all is said and done, you are a son of Africa. Your lineage is here. Your people are here. You must work hard with your team to adapt the recommendations for the corona to ones that can work more effectively in Africa. Africa needs a different response. To the United Nations, from which I retired, an organization that I love and have a great deal of respect for, I feel that you need to do more. This is the time in history where you, more than any other time, justify your very existence. You are the one platform that can provide a meeting and a prompt meeting place for all the world leaders. The world leaders must take on this global pandemic as their highest priority at this time. And the United Nations needs to provide, advocate, and ask for more and more of that to be done. I call on all our indigenous philanthropists in Nigeria and in Africa. Nigeria, for instance, can boast of perhaps the richest man in Africa and the richest woman in Africa. I was proud to know that Dangote was already helping the global efforts. But charity must begin at home. There is so much at stake. We have a choice. The world has a choice to recognize our common humanity, to take on this war as allies, as brothers, or to continue doing our own thing, laying blames elsewhere, delaying because we think we want the world to think we're already on top of it. But how this continues to unfold in Nigeria, in Africa, all over the world, will depend on whether this global, strong, coordinated response happens. If it doesn't, posterity will judge us.